Hello, friends and family. It's an honor and pleasure to have my colleague and friend and a dear inspirational colleague that has there to change the landscapes of health. And this is my wonderful dear Dr. Danny Pillay.
Well, thanks for the introduction, Reggie. Yeah, our association goes back almost a quarter of a century now, giving our ages away, and hopefully it comes with experience and some depth of wisdom about health and generally about managing the well-being of human beings.
Thanks, Danny. I think I always reflect on this in terms of what I do in the world, and I said the only thing that is relevant in the world today is change, and there's only thing that's constant in the world. And one of the principles that I tend to resonate with you, Danny, is about your principles of ever learning, and that there's always inspiration to say, when I ask you what you're doing, you always tell me that you're studying, you're doing some aspect of learning. And I think that I resonate with that, and I think that you also look at learning as a pastime, and I also look at learning and studying as a pastime. I think that resonance principle of inspiring each other and inspiring colleagues to know that there are people like you and me that can come together to make a difference. We may come from diverse set of backgrounds. I think our aim is one, is to be together to effect change integratively and not linearly.
Indeed, I think, when you choose a career like this, it's more than a career, it's a vocation. And it's a responsibility for us to get the best knowledge, the most current knowledge, so we can best serve people. And change is inevitable, but change is nothing bad. It's a case of new knowledge, new ideas, new foundations, and how we can explore the boundaries of ignorance and push further away from us so that we can better utilize the space and better serve humanity while being very kind to the planet. So my big focus is obviously in complementary medicines, and I look a lot at using homeopathy as a primary modality to treat, Chinese medicine, acupuncture, and using the philosophies of Ayurveda, Unani Tib, and understanding disease from a holistic point of view, and not looking just purely at the pathology, which is very important, but to understand the patient before you understand the disease.
I think this is fascinating. And coming from a dental background or the traditional dentist, I think that what made me change, the traditional dentist will look at basically in a crude sense, if I may say, drill, bull, and fill. And I realized that as a health practitioner, there's more than just a mechanical process. It's about using oral health investigative processes of diagnostics to understand that the oral health is related to the general health of the patient. And in order to understand that when the patient comes to me, what do I want of the patient? First of all, I want of myself to make sure that I engineer a roadmap for the patient to say that the patient will be in a better space when I conclude the first stage of treatment. In that context, I think that what Danny had said, that it's about integrated processes, but underlining that the principles of all medical fraternities are the same. That in order to treat, you have to treat the cause and not the symptoms. And I think that's where Danny and I have related to each other, that patients that who are common to each other is that we complement each other to look at the fundamental principles of healing.
Indeed, oral health is not restricted to the mouth. And I think no more than skin health is restricted to the skin. So we know that gut health is important for general body function. Oral health is good for digestive functioning. And we know that if oral health is not good, there's a risk for heart disease. There's a risk for all other kinds of things. So we can't see them as compartments separate from each other, where they actually work in harmony with each other. So we know acupuncture meridians occur in the mouth, and so the fact that your gut or your mouth functions or dysfunctions will impact the rest of your bodily functions. So that's what I like, the association of how we look at things and saying that, whether you're doing a certain mouth procedure, but it's having an impact on the entire body.
Interesting that you're highlighting about the microbiomes, and contemporary approaches to health have realized that microbiomes is critical to your general health. From an oral health perspective, that they are determined to measure the microbiomes in oral cavity, but that is extrapolated in terms of measurement for the microbiomes in your colon. And that goes back, and in fact, in terms of the depth of knowledge, to know that if a microbiome is not in balance, it impacts on your general health. And what do we take off from discussions like this? We want to ensure that we make a difference to people's health, to get ensure that they understand health better, to understand to transfer responsibility not to you and me, but to the patient, to realize the power lies within them.
Indeed, and when you speak about microbiomes, you understand that a human being who may be between 60 to 90 trillion cells has 10 times more bacteria in them than human cells. So you're sitting around 600 to 900 trillion bacteria in you. There's more bacteria in a human than there's animals on the planet. So we're an entire system, we're an ecosystem. We're not just a human being. We're an ecosystem for a myriad of things. There's more DNA and genetics of the microorganisms in a human than there's human genetics. So we have to understand how functional this human body is beyond just the human, but of the organisms that inhabit it and coexist. So there's a symbiotic relationship, and we need to understand that. And so when we're treating patients, we also realize we're treating an entire microbiome, and not just the human being.
It's interesting that you speak about function, and I could recollect that the talk that you had given some years ago on functional medicine, and whereby that the precept of medical sciences are amazing, and I think that we all agree there's a fantastic bit of knowledge, but I think the critical factor is that how do you apply it? What we call is applied science, and therefore I think that your integrative and integral knowledge in terms of functional medicine can come to the fore, and not only just complementary, but I think it's integrative to the healing from ensuring that the DNA of each individual is optimized to maintain the double helix structure.
Indeed, I think when we look at integration, it's just not integration about a health, it's integration of knowledge, of being, of purpose. So, we learn new things. We sometimes just look for point A to B, and we realize that it's not just point A to B, there's a convolution of meeting points and commonality in healthcare. So whether we even look from a single modality, whether someone's looking at healthcare from a Western medical model or homeopathic or a Chinese medicine or Ayurvedic, we're looking at achieving the same outputs with different methodologies or different approaches. But ultimately, we all want to bring and inspire the natural immunity and the natural healing potential of the body to do its work.
I think the last point that you mentioned about restoring the natural immunity of the patient. And we know that from an oral health perspective that in bone and gum health that we have a thing called the crevical fluid. And in that crevical fluid, we have the antigen antibodies. So how do you restore that optimally in terms of contributing to the defense of the body? And that's related to what you related earlier to say that about the meridians of the body. And we all know from modern day science of ancient sciences, the knowledge is surfaced now. Each tooth is related to a meridian in your body. Hence, that it's important to preserve the natural dentition and the neurological pathways from an oral perspective to the general aspect of the physiology. And so once you remove a tooth, you alter the neurological pathways.
Yes, and I think also that goes with it is the pathways and how we nourish everything. So it's also where we comment in about how people take their healthcare and as opposed to disease management. Healthcare in what we imbibe, what we eat and assimilate. Also is very important to maintain and nourish our meridians, our immune system. So I think where we've always had commonalities that we've looked at diet as an integral part. And this is not just about providing medicines, but giving the right nutrients to allow the innate immune system to work and develop and have the ability to bring about healing. And I think that's what's fundamentally good, that we look at holism truly this way, not just about integrative medicine, but looking at integrative health.
Yeah. I would definitely extrapolate that aspect of diet and health. And from an oral perspective that, and Danny, you and I have had many conversations about diet and change is about not is of the outputs, but what's the inputs, and in terms of natural diet as possible in terms of the intake. But the aspect of diet that you and I have discussed previously is about diet in relation to the pH balance. In terms of technically, if you're acidic, you are unhealthy. If you are alkaline, you're healthy. And how do you ensure that in terms of what you take? In this so-called contemporary situation that everybody talks about, high fat, and low carb diet, there are many extrapolations of debate and discussions around that. But from our perspective, we've seen that people on a high carbohydrate diet tends to have more oral problems in what we call periodontal health, gum and bone diseases, and around the teeth.
Well, as we know, early stage of digestion already take place in the mouth, where the amylase and obviously high carbohydrate diets going to change the pH in the mouth, gets the bacteria to activate, affecting your hydroxyapatite crystals and on your dentine and all of that. So that's going to go, but it also then affects your sugar balance. It affects your gut biome. So all of these contribute. So I think the idea of eating wholesome, natural foods, less processed foods, non-fizzy things, keeps already automatically a much more alkaline-based food, as opposed to eating lots of things that are processed. That whether you're having a processed food, but in order to process, they use a lot of chemicals and they use a lot of acidic mediums. You're bleaching certain foods to make them white, or if you want to make a white table sugar or white flour, you're using all these kind of things that eventually impact on the gum health, but also impacts on the general body health and changes the body's biochemistry.
Danny, I'd like to leave a parting shot for the viewers in our discussion that has taken place thus far. What can individuals do to ensure that they seek the solutions to the cause of effects of health?
Yes, I think that we've covered so many aspects today. I think the next time we can focus on different aspects of it, so otherwise it gets too muddled. And we've got so much to talk about, and this conversation can go on forever. So we should look forward to doing some individual topics that the viewers would enjoy.
Thank you, Danny. We look forward to engaging with our viewers in friendship across the world to ensure that we play a part in optimizing health of populations. Thank you, Danny.
Welcome.